right in here. Thanks, everybody. Thanks for the introduction. It's the end of our summit. So we're in the last hour, last 45 minutes of this wonderful summit. How we're going to wrap this up is basically we're going to have a discussion, and we want to make this as interactive as possible. I know that some people have left, and I know some folks in the audience or online might have gone away. But nonetheless, we are going to make this as interactive as possible, even amongst ourselves and amongst our panelists online. But we are talking in this session about data and new ways of looking at indicators to guide health sector investments, climate health sector investments. Our panel has already talked a lot about how we want to do this, and as I said, we're going to make this interactive, and I'm going to be very brief in the introduction. We have 5 excellent panelists, and the way we're going to be doing this is we're going to actually talk about 3 different themes in the session. So, and after each theme, we're going to take a quick 5-minute break to do a Q&A and have a little discussion amongst ourselves, and then go on to the next theme. Okay, those 3 themes, these are very general themes, by the way. The first one is on leveraging data systems for AI for climate health adaptation. And this is particularly focused in low and middle income countries. And this topic will be introduced by Hosni Ghedira, who's a professor at the Mohammed bin Zayed University of Artificial Intelligence, as well as Felipe Oviedo, who's a senior research scientist at Microsoft, and he's joining us online. The second topic is going to be about data-driven investments for climate health resilience, and this is where we're going to be discussing things like how cities and countries are utilizing advanced data, risk, and metrics to inform different types of investment decisions. So this topic is going to be introduced by Dinesh Arora, who you've already seen multiple times today, so I won't introduce him again, from the Asian Development Bank, as well as Daniel Stander, who's the Deputy Chair for the Resilient Cities Network. And then finally, we're going to wrap up the last theme talking about market innovation for health resilience through credit systems, where we're going to be talking about the creation of a health credit trading space. And this is going to be introduced again by our online panelist, Andrea Feigl, who is the CEO and founder of the Health Finance Institute. So let's just kick off, and we'll start with Hosni, who's going to be discussing leveraging data systems for AI in climate health adaptation. Go ahead.
Thank you, Bill. I think it's very important to see people from the healthcare sector and also people from academia and research, and have the AI community joining this debate is very important, because usually we are talking and speaking different languages. And so the recent advances in AI, especially in the climate and the climate modeling, is progressing with tremendous progress made in the computing power, and a lot of competition now with the big technology provider in terms of making this technology available for climate and weather. Now, AI is increasingly used for weather forecast and climate forecast. And I will talk about our experience at the university. So we are located in the UAE, in Abu Dhabi, the capital, and we are dedicated R&D university for AI. And we are fortunate to work with Forecasting Healthy Future in many projects, focusing on Asia, in malaria for Indonesia, and one of the projects that is supported by Reaching Last Mile, as part of UAE, Abu Dhabi government, is to see how AI can help in eradicating and supporting the effort to reduce the impact or to mitigate the impact of climate on malaria, because we know that malaria is a climate-sensitive disease, and we try to link the causality between climate and also outbreak pattern in different vector cities. So what we are using for now is how AI can help first in the climate modeling, and we are targeting on season-to-season forecast, where we can predict the pattern of more rain, some like humidity, the change in the land cover, that are all the trigger for mosquitoes outbreak on those affected areas, and how we can have this, use AI, especially the data fusion in AI, to merge data from different satellite platforms, different sensing, ground sensing technology, and to integrate all this data and try to link this pattern in the climate and weather variation in some disease outbreak. So we are collected archived data from different centers, and we try to understand how climate change, how weather pattern is impacting this variation. And because here also we focus on low and middle income country, and this is very important where AI can help, especially AI combined with satellite data, where you can access to some remote area that you don't have any ground measurement network, and you can collect data. Mainly when we talk about malaria, we're monitoring like precipitation, humidity, vegetation cover, that we believe, and we find out there is some causality in terms of mosquitoes activities. And also we added the wind speed pattern, because when you have a windy conditions, so it will be less activity of mosquitoes. So it sometimes is very challenging to have this direct link and the lag between number of cases and some weather pattern. But we are focusing on integrating AI for short-term forecasts and also for season-to-season forecasts, where we integrate data, we predict some climate pattern that we expect to have, and we can have some prediction in terms of some increases in some cases, some outbreak there, where health workers can take action in advance and have some readiness for that. So this is a summary where AI and the AI community can support and already supporting and contributing to this global effort.
Yeah, that's great. So we have the same types of approaches to looking at data. I know in our systems we also take thousands and thousands of variables and use AI now to fish through them. So I want to turn over to Felipe and hear what's going on over in Microsoft. Felipe.
Great, thank you. Yeah, I think we've had a similar experience in terms of combining AI and geospatial imaging for health projects. We have done a few. So we have this large collaboration with Planet Labs, which is this like satellite data provider, very high resolution, and we mainly have used that for disaster response. So like quickly response to flooding or like earthquakes. We have a very good pipeline to like see like what percentage of buildings are damaged after a disaster, and like prioritize responses. Some of these, of course, can be health, but doing these like these assessments of like you have a large area, you identify the buildings, you identify features from it, like my fellow panelists mentioned, like vegetation, other like different kinds of features from satellite imaging. You can actually get other useful information. So the two applications that we haven't done a lot in terms of like healthcare and climate combined, but the two or three we've done have been one like simply estimating like heat risk in India using satellite imaging, and then looking at the type of construction and correlating like risk. So you could imagine this as some sort of like corrected heat index. We have explored also other things like population mapping. Like we don't need to even like correlate to a health outcome, but what we found, like even like simple, accurate data about population and what are the needs of the population based on geospatial data is actually quite useful. So we are working a project actually that right now to like get corrected estimates for populations in high growth countries in Africa. And we learned quickly that, data fusion is crucial. Having like a clear understanding of like what you want to achieve in terms of what you want to predict related to health outcomes or health variables is critical as well. And I think like there are very limited projects on this usually, or limited initiatives. So there's a lot of opportunity to have great impact, no? And a lot of the ways in which we think about health and public health have been like there for the last 15, 20 years, but they have not been informed by this additional multimodal data or like sensor data, etc. So I think there's great opportunities in the field.
Great, thanks, Felipe. So at this moment, we're gonna, since that's our first theme, we can have discussions within our group. But since I'm a professor at Duke University, I also reserve the right to count and call on people in the audience. So we do have a microphone. So folks who I know who have a lot of expertise in looking at data for decision making, specifically in the climate health space. James Colburn, I know Mark Janko, Henry Cardenas. I expect some good questions from you all.
Can I respond?
Yeah, please.
In the spirit of making this interactive, that prompted lots of thoughts. So I have a lot to say, but I'm going to keep it brief and see where it goes. We're an event that is around climate and health. What I heard in terms of data and analysis, let's forget whether it's remote, whether it's satellite, whether it's ground sensing, whether it's AI, let's just call it data analysis at an event that's around climate and health. I think I heard 90% around climate and maybe 10% around health in terms of how this technology is being used. Did I miss here?
Yeah, so the health, especially for infectious diseases, is one of use cases. So when we are developing AI-based climate forecast or weather forecast, so it will be used for many applications. So the same technology can be applied for food security, for many applications. But health is one of them. And what we are doing is having this linkage between the health community and the AI and the climate community, because so we have to put them on the same table and speak the same language at the end, because it's very important to understand the needs in the ground, because we had very good experience the last 3 years by interacting with our colleagues in Indonesia to understand the data structure, the challenges collecting data, sometimes the challenge for data privacy as well, how they can share the data outside their border is very challenging, especially it's very sensitive data for countries. So for us is to have this linkage is very important to put together our objective and to see the needs of the end users and to see how technology can help. So it's true, my intervention focuses more into data, more into climate, but definitely I think the healthcare is the main, is the end user at the end for those collaborations.
I think that's a spot-on question, So in this, I represent health and do a little bit of data. Many of these guys know more of data, but less of health, right? When we are trained as a physician, I'm not sure we have any course on digital or AI in that medicine. We do anatomy, physiology, biochemistry, medicine, surgery, but not data sciences. We are not trained, but this is the change we are bringing now. In the morning when I was discussing the case studies, we are actually bringing digital health as one of the training leadership for not only the students who are coming out, but also those who are working in the health system, in the public health systems, to how do you use data. In fact, if you don't mind, I have a couple of slides just to showcase this.
Sure.
Can we have the slides on, if possible, for Dinesh? Absolutely. This is the major problem we had, that we had data scientists who didn't understand health much. We have lots of health guys who doesn't understand data analysis much. How do you make them marry and how do you make them use? Because at the end of the day, it is the climate and the health guy who is working there in the district, maybe a district heat officer or a district disaster management officer who has to use this data and share with everyone else. It's very important how we interpret the data available and make them easily usable. And that's so we are coming up with a playbook. When we do a CVRA, what we call as climate vulnerable assessment for every project. Say we are supporting a province or a state on establishing medical colleges. So what are those vulnerabilities which are present there and how do those vulnerabilities get tackled through climate and health financing? If that is the case, it actually helps me in interpreting. So can we go to next slide, please?
Yeah, I think
I'll go there. I'll take it. Yeah. Thanks. So if you see this, can we have the slides back, please? Right. So we are coming up with a playbook just to showcase how data generated can be used by project officers and the country members of how the vulnerability, the exposure, and the climate financing, whatever the interventions are being made. Say, maybe perhaps we are training them or we are making a resilient infrastructure. How that gets dovetailed, then you can calculate your carbon footprint number out of this. So if you have done this intervention, say for example, a hospital has been made green, how many carbon emissions reduced and how many people benefited from this, that comes automatically using the AI tool. So we have superimposed through our partners, Arup is working with us very closely, and they have superimposed the data which is being used for measurement of climate financing, of how it can be mitigating, can come in one slide. Can I have the slides on, please? Okay, it's coming there. Okay. So if you see this, we have understanding the climate finance potential, reading and interpreting the climate risk and vulnerability assessment, quantification of the same, and then climate finance reporting. So the climate finance reporting actually goes digital with the help of AI. So when we are devising any project, we use the AI tool to come forward to it, what are the mitigation numbers and what are the adaptation numbers and what are those modalities being used. This will go online in our Inspire workshop from 7th to 11th of July. Similarly, somebody talked about GIS. So how disaster management can be done through GI mapping is also what we are using the AI tool with Earth Observatory. And this is going to be used to put up in a climate and health portal. So we will have all this information available online for everyone to be seen. This is one example you referred to. Precision action for climate and health. Superimposing climate data on the burden of disease and then coming up with resource allocation. City of Tobacco in Philippines is implementing this with fantastic results. And finally, I think somebody mentioned also here, building a heat resilient tool using AI, not only about temperature, but also about humidity, the population density and the buildings there, and then coming out with those are the heat islands in an area which need protection. This is how ADB is trying to mainstream data analysis, data and diagnostics within the climate and health system. Those are 4 first slides. Thank you.
That's great, Dinesh. Thank you so much. That's, in case you didn't notice, we've moved into our second theme, which is the data-driven investments for climate and health resilience. Daniel, I don't know if you have anything to add from your experience.
Well, I guess quite a lot, but I don't... My comment earlier was not a critique, it was an observation, right? And I like your response, Hosni. Mm-hmm. We've been using remote sensing technology to understand weather and climate, which is different, but let's focus on weather for decades. And then once we have that data, we can use it intersectionally across a whole bunch of different things. It could be its impact on aging infrastructure, or it could be its impact on coastal communities, or it could be its impact on productivity in the workforce, or on health. Right? So it's a one application, an important application of that kind of data. And then you can get into lots of conversations about whether you need to use optical versus synthetic aperture radar and what the various advantages are and how you make that useful. That to me feels like a climate-first approach to using data. As opposed to, if I was, I'm not a public health expert, right? I'm not a physician. But when I sit with public health experts and I ask them about technology innovations that are helping them do preventative interventions, on the previous panel they were talking about, 1 ounce of prevention being worth 10 pounds of cure or whatever it is. When I ask them what are the technologies that are driving preventative interventions, one of the top 3 every time is genomics. Yeah. So if I was to ask myself, what would a public health first conversation look like around use of technology? It would start from there. How are we monitoring humans and their health? And what impact is the climate having on humans and their health? Now, I'm not saying this to say that's what we should be doing. We shouldn't be using satellite data to understand weather. I'm just trying to make the point. And I think it was Ollie, when he did his trip down memory lane as we went through to the first health day at a COP, where you have these, if you like, factions perhaps, that were a bit suspicious of one another, the climate experts and the public health experts. And I feel in this panel so far, we're coming at it from a climate perspective, and I would love to see us think about it perhaps a little bit more from a public health perspective and what data would be useful. So for example, last point on this to really make it plain, if somebody walked in to a physician's clinic and said, I'm feeling ill, you would take their temperature, not the wet light bulb temperature outside, not the ambient temperature, right? Would be more interested in what's going on for them as a human than what's necessarily happening in the environment, because that's what matters in terms of health. If we can bring all of that together, to design solutions that use the data to understand what's happening in the weather, and then what that means for humans and what they're feeling, and then design preventative interventions, then I think we're having a joined up conversation. That's the point I was trying to make.
Yeah.
We have a question in the audience.
No, thanks, Daniel. And this actually went to a point that we made during the panel on metrics yesterday, was that what are we doing, I'm curious to hear from the panelists, what are we doing to improve the epidemiological surveillance data that's being gathered in the clinics and hospitals? Because if we're not gathering the right data, if we're not updating our ICD codes or equivalents to ensure that a health-related, case of eclampsia or cardiac issues or respiratory distress, if that's not being explicitly linked to exposure to a heat wave or an infectious disease, exposure to flooded waters, it's going to be really hard to make the case. So what are we doing to improve the monitoring, the surveillance, and the electronic medical records?
So I can respond to that if nobody else wants to take that. So I know in the work that we do, so I think, Daniel, what you're referring to, in my perspective, is the co-benefits approach to public health and the environment. So looking at, not just climate and not just land cover change, not just malaria, not just dengue, but let's look at, the array of vector-borne diseases that share an environmental risk, and can we identify, signals in the environment that relate to all of those outcomes, and which ones are important. And I think for Anna's question, how do we improve electronic health records? I think that's really critical. I think that basically comes down to how surveillance systems are working and how quickly they're reporting information. But to me, it also has to do with how are diagnostics deployed in small rural health posts? How is that data being reported to a health system? And the places we work in the Amazon, sometimes you can have a diagnosis of malaria on the border of Ecuador and Peru, and it's not reported in the health system for 12 weeks later, right? So you can't make a decision as a decision maker if that data is not reported in a timely manner. Whereas the climate data we can get actually on the day. And that's a big difference between the data availability. And Felipe, I did want to kind of point you out for some of the things that you were identifying. I didn't know if you had any comments about that question on electronic health records and anything that that you're doing related to that.
Yeah, I think this comes up a lot, and like we've done some work on electronic health records in Washington State, and even like keeping a developed country like the right signal is very challenging, right? So in more challenging environments, I could see that it's a big issue. One thing I think like if you think about like the health records, right? Like there is heat stress, we have patients that have certain conditions, say cardiac arrest, etc. So that's usually what I think is the critical piece, no? Getting the data, inputs, what to model tends to be easier than actually getting like the human outputs, the human labels, what you want to predict, no? And you don't need to be perfect about that, but like you need to have enough signal from it that you can make informed decisions and informed policies, right? So for example, in this heat stress work, we did exactly that, right? Like we correlated to like the records from hospitals and clinics in some area that had a heat risk index, and then you can design policy in terms of like, okay, we need like to inform more to the people in New Delhi in this particular neighborhood about that, right? So what it gives you both granularity, but in the end, one of the bottlenecks is always data, but not sometimes the data you imagine, right? The data that the actual patient outcome or the actual individual health is important. So I fully agree with that take. Yeah.
Well, let's move to Andrea online because she's been quiet. Sorry, Andrea, that we've been keeping you online. But I did want to ask you to comment about our last theme, because I know that you have an incredible amount of experience in thinking about and developing tools for market innovation and building health resilience through the credit systems. So I'm wondering if you could give us some of background and tell us a little bit about what the Health Finance Institute is doing.
Absolutely, and thanks so much for having me. And I appreciate the difficulty moderating both live and virtually. So thanks for accommodating me virtually. If I may, I actually would love to comment on the last discussion, and I think it is, and in the end, I hope you see how it is relevant to what we do and the health impact credit work that we're doing, where, I love the notion around the joint outcome conversation and sort of like what data, how do we deal and optimize the data, the concentricity between that data on climate or climate and weather patterns and health outcomes, right? So talk about epidemiology, right? Epidemiology is all about is population health and its causal inference in the end, what can we do to the exposure to change the outcome? And we're just beginning to understand the mediation of climate. So basically, right, like you have a certain exposure and then the outcome is exacerbated and or directly impacted because of different temperatures, extreme weather events, and so on. So I think where we need to be better is putting that to work in communities and in clinical delivery settings, and also just in the way we communicate that impact. And this is where there's just an emergence of that field in epidemiology and in economics, where we're just beginning to understand how many more heat strokes will we have now because of the change in weather patterns, how many malaria cases in the more northern settings will we have, how many more respiratory illnesses and so on will we have, and how can we mitigate that, or even better, how we can prevent them, right? So to me, it's not necessarily always about the immediacy of the data, but also how we're starting to apply them and link them in our care planning. Now, back to me and the Health Finance Institute. So I'm an health economist by training, and have been looking at the economics of chronic diseases and health financing. And the Health Finance Institute, we're based in DC, and we're a think tank, and we concern ourselves with building economic business cases for investments in access, adherence, and prevention. So like basically we're saying, well, what do we do with data? What data do we need? How do we transform the data to make the right investments into creating healthier societies? And because of the size of the impact, and I don't know if that was mentioned in previous panels or whatnot, we're really looking at, a burden of 5 to 15% of GDP losses because we're not investing in health in the right way. And no single economic analysis can, move the needle significantly. So what we have done is we've developed a concept called the health impact credit, where we're trying to basically capture the impact of commercial and large-scale health systems, and measure that impact and correlate that with the bottom line or the value of a company, but also offer trading systems. So it's a market innovation addressing the need for structural and large-scale investments in health, and because currently the markets don't reflect the true value of health, right? The added benefit of a Moderna, of companies that contribute positively to health isn't captured in their value, in as much the value isn't captured in companies that contribute to ill health. And so the concept of the health impact credit that we've developed does three things. We say, okay, how do we quantify, based on a few rubrics, the health impact of large-scale activities or large-scale commercial actors? How do we unify that impact? And then can we establish not just a tokenization of that health impact, but assign a value to it and create a market where there's both demand and supply of these health impact credits? And part of the health impact that we measure is also linked to climate change, right? How do large-scale commercial actors, how do countries, impact sustainability and, CO2 emissions, and how much of that is then again filtering down to affecting health outcomes, and how can we then measure a positive change over time? We recently started to engage with Bayer. So to develop that particular metric for the consumer health space. We're super excited about that. And we'll be launching an MVP in about 2 weeks at the World Bank Spring meetings. We'll have World Bank and IFC, and also been engaged with the World Economic Forum as a platform on that. So just having seen the earlier presentation here, and I'm sorry I didn't see in full granularity, but the data that's being produced around how interventions have certain health impacts or certain climate-related activities have impact on health outcomes, that's the data we would feed into our algorithm and then present into the sum total or the net positive impact that we're presenting on the health impact. It's a bit hard to gauge the understanding or the nodding or the questions on your faces sitting here virtually, but I'm going to stop right here, and thanks for the opportunity to share about that.
That was really very good. Thank you, Andrea. I found that really interesting. I'm really interested to know about your opinion, Dinesh, because that was very similar to what you were talking about.
I think when we talk about collaborative surveillance, where we have the climate and the health data, it's good for an outbreak diseases, but not at the individual level. Like in Asia Pacific, there are less than 10% of the people having electronic medical records. Less than 60% have a unique identifier within a country. So when COVID hit and you wanted to track each vaccine being given to a person, only 50% we could achieve. Many of the countries don't have a unique identifier for identifying whether it's SSD number or it's like in India, it's Aadhaar, which is actually a link, one unique identity for every person. So if you do not have an electronic medical records, if you do not have a great record keeping for data, it's very difficult. I think what my colleague said from there, ICD-10 or 11, if you are using, you will always record it as a cardiac arrest. You will never say that it happened because of the heat stress or because of the flooding. So initially, I think we have to work at two places. One, when we are superimposing climate and the health burden of disease at the macro level, outbreak level, possible immediately. But to reach it at the individual level will take some more time because the health sector has to catch up on what's happening on the other sectors on data. Yeah. That's my analysis.
We had a question.
Thank you all. This has been a great conversation so far, and since I already got called out, I do feel obligated to ask a question. It's a question. And I'm going to try to, if you're really imaginative, link a number of different topics that got brought up together. First of all, I've been working in public health for a long time, 20-something years. I don't know. I won't age myself. But I've only used, or at least AI-generated products, I would say, once I started getting into the health and climate impacts on infectious diseases and malaria in particular. So that's to say that I think that there are some questions that are definitely most appropriately answered using technology like AI, and there are some in public health that don't need that kind of technology. I do feel like using weather and climate to predict burden or identify vulnerabilities or vulnerable populations that are sensitive to climate-sensitive diseases is one of those. It can help us identify and target interventions or identify vulnerable populations. Target interventions has been laid out clearly. It does not, however, eliminate the need to collect data at the individual level, as also has been discussed, because we need to be able to have extreme granularity on the success or the lack thereof of the interventions that we put in place as a result of that. Now, all that said, the areas where we would need or in theory potentially use or benefit mostly from using some of these AI-generated predictions on vulnerabilities or burdens of climate-sensitive diseases are very usually low-income settings that have challenges for various different reasons for things like electricity, maintaining servers and whatnot. And when you couple that with the potential carbon footprint of using technology like AI, what are our views, or what are your guys' views on scalability here? Should we be looking regionally? Should we be trying to focus some of these analyses in places like Seattle, in Microsoft and then divulging that information, utilizing local information and applying it locally? Should we be building this capacity? Because normally I focus on building capacity first and success and outputs later. This is a case where I'm not sure that's right or not. I'm just kind of bringing it up as a query because I'm curious what other people think on this. Thank you.
I'm pleased you asked the question because I've been thinking the same thing and I don't have the answer, but I know others who are looking at it at the moment. I think the whole topic is super complex, and what you've just pointed out adds to the complexity. The way I think about it is this: go to something like genomics. Genomics will let you know not who's going to get what disease, but it's not causation. It's going to give you a sense of probabilities over time. You might end up, therefore, preventatively treating somebody because there's a higher likelihood that they might, in future, fall foul of some kind of disease, but we don't know for sure. We think that the prevention cost-benefit is going to outweigh treating an acute phase later on, but we don't know, and you could end up treating somebody unnecessarily using data or using AI technologies that themselves have a carbon footprint, because we're making a long-term bet that treating them now is not only going to be better for them and their life outcomes, but is going to relieve the burden on the healthcare systems. All I'm doing is laying out the complexity of that math, right? That economists, others need to do, and then need to put the tools, not the answers, I think, but the tools in the hands of the decision makers, which could be public policy decision makers or could be private healthcare systems providers, so they can then make the right bets over time by region and make decisions that will be both climate positive and health positive. I don't have the answer, but I can see in my mind what the model needs to look like, and that we need to empower those with those kinds of models so they can input their suite of potential interventions. So we move from what we heard in the previous panel, which is just, I say just because it's an important first base, just quantifying the cost of inaction, to quantifying the value of intervention and investment, which is what Andrea is talking about. But I think that's the kind of modeling that's required.
Yeah. It's an important question, because when we discuss AI and climate, always we talk about the carbon footprint of all AI algorithms that are used for it, and it's true. But now there are a lot of effort in terms of making AI modeling more sustainable in terms of carbon footprint. But here, for the application for healthcare, it's very important to mention that the training of algorithm will take a lot of power at the beginning, but the deployment and running those algorithms will consume much less energy. For example, for the weather forecast, now what like GraphCast is doing and what NVIDIA is doing in terms of providing like weather forecast as accurate as physical-based modeling in 1 minute, it's consumed like 100,000 less energy, because you can get it in 1 minute. And this is going to be applied when we train this model, and like the day-to-day deployment of this model will consume much less energy at that.
And I think I began to hear a shift between modeling what I would just call hazard to modeling impact.
Yeah.
And again, I'm doing this not to set out the answers, but just the mental framework for how I think about things. We need to model the hazard, we need to model the vulnerability, we need to model the impact, and we need to model what I would describe as the net impact, where it's net of intervention, where intervention could be a physical intervention, or it could be a financial services intervention, for example, an insurance product. That's the four-pronged model that needs to be set out, and each of them is difficult. If I just take the hazard piece, I want to model not just hazard frequency, but hazard severity and hazard location. And hazard frequency is hard to do. You can capture it over a short period of time, but we're in this room because we know that history is a poor precedent for the future in times of frequency, severity, and location. Right? So just getting the hazard modeling is tricky, but we need to be linking that up through the vulnerability, which is vulnerability in the way that I think Dinesh was describing it, which is what I would describe as socioeconomic vulnerability, human health and poverty, but also physical built environment vulnerability. An engineer would talk about how likely is it that that roof is going to fall down and injure the people inside. So we need both those types of vulnerability, but then what does that mean in terms of impact? Impact on the vector-borne disease, or impact on losing your job and your inability, therefore, to feed and clothe yourself, and all the health impacts thereof. And then finally do the net of. I want to develop a suite, a portfolio of bankable interventions that Andrea and others can take to the bankers and decide whether they want to be invested in. And I need to understand over multiple time horizons and how it varies by geography, what that's going to do in terms of a return. That's the modeling that needs to be done, and we can take as an input for certain some of the remote sensing that's being described, but it needs a lot more than just that.
It's true.
I think Daniel did a great job of summarizing the energy from this group. I did want to give, I know we're out of time, but I did want to give the speakers one last moment, maybe not Daniel, since I think you had your last moment. If you have any parting words about anything that was discussed today, we can start. Let's start online with Felipe and Andrea.
Yeah, I think to the question on just thinking how to deploy AI, how to even start, right? Like local versus like develop capabilities. I don't think there's like a perfect answer for it, but one interesting thing of applied problems is like in healthcare and like in the climate space is like the more you can develop a platform that like have several capabilities, the more you can do. So for example, just simply getting accurate population estimates, right? Or like accurate building characteristics from geospatial data could be one example. Other very big example is simply getting like genomic data from patients, no? Like building a platform that then later had like downstream application, I think like is the pathway for success, because like, yeah, this hugely complex set of problems, but I think that at the end of the day, you can like adapt and like design different solutions for different problems, no? And then like in terms of impact of AI versus like the positive impact in society, I think like so far, like, and the reason we're investing so much is like that because we're seeing like the impact, right? Like just not simply in like in productivity or dollars, but also in outcomes. So I think there's a lot there, and like a lot that can be done, just like tweaking your approach to the right problems and using the right tool for the right problem. No, yeah, great discussion. Thank you.
Thank you, Felipe. Andrea, very fast.
Very fast, yeah. I think that in terms of the Gen AI or just AI approaches, I think there's in health and linking health and outcomes and financing, there's a lot of data model building, and that needs to be done. But we're definitely we're actually also building and enabling AI through the model that we're building. And I just wanted to also thank and echo what Dan has said about laying out the ecosystem or how different data and analytical activities connect. And sort of like, and how we link that, you know, the climate and health and epidemiology to outcomes to actually the financing. And, you know, I think this is really the ecosystem mapping that we need to do as the, and enabling and as actors in this room. And just as a footnote, what is really interesting and what struck me that I learned earlier that, you know, NVIDIA, for example, this year, had like a reduction of 99% of their compute for like similar models in terms of energy usage. So while we are not, you know, while this remains an issue, I feel like we should also, you know, we have to watch that space closely. And I think we can also get to a future where over time, the health, the climate impact of the data and the compute that's needed is outweighed by the positive impact that these analytics offer us. Anyways, I'm an optimist in that space, so I always like to end on a good note. And thank you so much for having me.
Okay, thank you. Hosni, any
I
parting
think,
word?
yes, quickly. So I think it's very important to bring all this community together, public health, AI, and also the climate. Now, AI and climate, we start developing some clusters where you can find machine learning people that working full-time on climate modeling. So we already have it, but healthcare and AI still developing. So to bring all those experts on the same table to have this debate to define and develop well-defined use cases where AI community can propose a solution for it.
Last word.
As a practitioner, it took us 20 years to bring World Meteorological Office and WHO in one room and share data and work on this.
20.
Let's not 20 years.
Don't wait.
So let's not AI wait for that. I think the marriage of AI, public health, and climate and health should be much faster. Both should be exposed to each other to get the best out of that.
I agree.
That's my message.
Well, thank you all for sticking with us for the last extra 5 minutes, and I will hand the floor back to Kelly or Lacey. Okay, thank you very much.
Thank you.